So we're here in the downtown of our new facility. We were really hoping it would be a really bright, lively, animated space, much like you would experience in a real downtown of a city and a streetscape.
And I think that's what we did, is we picked up on those key ideas that you had conceptually and tried to represent them in the architecture of the building by introducing natural light coming into this space. Along the streetscape here, we've kind of conceptually identified building facades to give that sense of the downtown and kind of urban character. And so we've got a gift shop in here, there's a small cafe, place where people can get their hair cut, there are music rooms and gymnasiums, so it really is the activity center of the facility.
And also spaces like that are intended to promote engagement of the community, bringing the public in to use the spaces, while also engaging the patients in sort of normalized environments and activities.
And I think that's one of the things that we find particularly successful about the building, is that you come in here and it doesn't look like your typical 50-year-old mental health facility, but it really looks more like an engaging place where people are gaining wellness, and then we'll be able to transition from here out into the community.
So the role of spirituality in the recovery of individuals with severe mental illness can be extremely important, and I think this space really represents the significance of that.
Well, we really did take this very seriously and tried to create a kind of modern interpretation of a chapel space.
There's been a lot of work done with using the labyrinths and incorporating meditation into patients' care, and some research going on in that area as well.
And then outside we have a chapel garden out here, and the labyrinth is also repeated out in the paving work outside.
I think it'll be a space where our patients find great comfort.
One of the things that we did is this, from an architectural point of view, is a kind of a really special space within the facility, and I think that kind of relates to St. Joseph's tradition as a faith-based organization.
So this is the Ontario Review Board hearing room, and it was really designed to respect the significant role that the Ontario Review Board plays in the progression of our patients through the forensic system.
Yeah, so what we were trying to do in the design of this space was to give it that kind of sense of prominence and character and import, but also making sure that there was, again, natural light with windows, because it obviously must be a stressful time for everyone involved. So here we are on the second floor, where we have great visibility into the downtown area below, views into some of the office areas like medical records or administration. Also on this floor is the education area over here, where there are training rooms. And in the far end is the library that's for patients and staff.
So we're standing outside the library, and the library is designed for both patient and staff use, and it's an important component of our academic mandate within this organization, so it is a nice space within the facility.
And so we put it up here on the second floor, where there's natural light coming in from both sides, and there are kind of private areas for reading, larger areas for group research activities.
Cameron, this is a key transition point between the downtown and the neighborhood. What was the design concept here?
Here we were really trying to do a number of things. Basically, this space in behind here, which is a really nice seating area, is kind of a transition zone, as you say, between the house unit, which is on the far side, the neighborhood, which is this zone in the middle, and the downtown zone.
Well, I think for patients, what's wonderful about this is they can visualize their journey and where it can go to. They can see from inside the house into the neighborhood and right into the downtown, so they can see into their future.
So at this location, you can kind of understand the sophisticated security system that is in use in the building. At the far set of doors over there, there's a location which restricts patients within the house unit. If they have privileges, they're wearing a wristband, and as they approach the door will automatically unlock, and they can kind of circulate in there. And they may even have privileges to come into the downtown zone here. So this door right behind me will open up as well.
And yet the system is very unobtrusive. One wouldn't know that there's such a sophisticated security system.
One of the things, by introducing a lot of glass into the area so that there's good visibility through, it's all kind of safety glass, but it really helps to provide another level of safety and security so that there aren't any hiding spaces within the building.
Yeah, in contrast to older buildings, the visibility allows sight lines for observation by clinical staff that really enhances the safety and security for all.
Right.
So perhaps we could move into the neighborhood.
Sure, why don't we?